HPIE 3.0. And in this panel discussion, we are going to discuss the roadmap towards global MVT hub and Vasudhaiva's Swasth Kutambkkam. So please welcome our speakers who will be talking about Indian MVT services. Please welcome our moderator for this discussion, Dr.Bidhan Das, Managing Director, OCTAVO Consulting and Chief Author, VIF-GMAAF MVT Task Force Report. He will be moderating this discussion. Please also welcome our other speakers for this panel. Dr. Prem Jagyasi, CEO, Times Awarded Speaker, Masterclass in 65 countries and a Chartered Accountant and Expert. Please welcome Dr. Vishnu Panigari, MD, Group Head, Medical Strategy and Operations Group, Fortis Healthcare Limited. Please welcome Dr. Sanjeev Singh, Medical Director, Amrita Institute of Medical Sciences, Faridabad. Please welcome Ms. Akriti Bajaj, Senior Assistant Vice President, Invest India, New Delhi. Dr. Sameer Gupta, Cardiac Cath Lab Director, Director, Metro Group of Hospitals. And Mr. Ishan Pandita, Joint Director, MVT and AYUSH, FICCI.
Good afternoon. Thanks, Afzal, for giving us this opportunity, and Medgate, of course, all your team. We have a limitation because I am told there is a paucity of time because certain sessions went beyond the stipulated period of time. So we have our esteemed members. I think Dr. Vishnu Panigari is missing. Sanjeev is not there. Sanjeev will be coming. Sanjeev is not coming. All right. So I'll set the subject a little. I'll give you an introduction why this is a matter of discussion here. I think it was a sequel to the G20 summit and went backwards to the summit in Bali last year and of course this year. And our friend Manish took the initiative to delve into this subject and probably publish a approach paper. We all felt at some point in time and that probably the approach to the particular trade or business is mostly sketchy, and therefore a little organized approach would be preferred or advisable. That was the context, and there is a lot of business opportunity where the nation and our country, Bharat, will be benefiting. So that was the intent. So with this background, we have, I think, Dr. Prem Jagyasi, who has been working on this field for a couple of years, and I think he will give an insight on the practical elements. Apart from him, we have Akriti. Akriti is into Invest India, and they are mostly, she is interested into discussing some portal that they have launched this year, I'm sorry, yeah. Ishan works for the FICCI, and they have been spearheading this business model and done some groundwork, and which I wish he can deliberate and enlighten the audience. Afzal, I bet we will stick to our time. Now it is 4 o'clock, and I think we should wind up by 15-20 minutes, if that is okay. Ishan? Sure. Okay. All right. First and foremost, if Prem could be advised to suggest, what do you think is the approach currently, and what could be envisaged for the future on account of this medical value travel?
So, you can hear, right?
It works.
Yeah, thank you. So, medical value tourism or medical value travel or known medical tourism is around $100 billion industry. In India, it's around $5 billion, and they are projecting that it's going to become $10 billion in the next 2-3 years. But what's most important thing for us to understand that India does possess great power and potential to lead into the medical tourism, but it's not happening as of now. There are lots of fallbacks here. We see Turkey doing incredible promotion, Malaysia doing very well organized medical tourism, Thailand also leading the way. We do have lots of challenges to deal to make India as a leading medical tourism destination. But one thing which surprisingly is happening these days, especially post-COVID, is growth of wellness tourism and integration of medical and wellness tourism together. And in this segment, India has an incredible advantage because India does provide exceptional wellness services, and AYUSH Mantralaya also is there. So to take you further, if I talk about across the globe, if you say that medical tourism does look like a global industry, but it actually is not a global industry. Allow me to explain that first, right? You don't see patient in India coming all the way from UK, USA a lot. So patient to India coming either from Africa, some from Middle East, some from CIS countries. If you go to Malaysia, they don't get more than, they get only 80% patient from Indonesia. They don't get from everywhere, right? Even if you look at Thailand, they're getting patient from Australia, New Zealand, little bit Middle Eastern. So as a provider, you are regional. As an industry, it looks like a global, but as a provider, you are regional. And our focus has to be a lot over there. Our marketing needs to be niche. Our area needs to be segmented. And we do need to create these kind of forums and activities in India and across the globe to raise awareness a bit more and build a little bit tourism infrastructure also if you want to lead in medical tourism industry. But there is an incredible opportunity, to be honest.
Right, thank you, Prem. We appreciate, we know, all of us know Kerala, how Kerala has been doing this Ayurveda spas, and not only from CIS, they come from all over Europe and US. Well, that is an established industry for the last 2 decades, a little more. That was the context when we started writing the accreditation standards for our country, which we call it as NABH. We took that model, and that is how our genesis of these standards were. But let us keep the discussion more to India-centric or Bharat-centric, if you all of us agree. We are interested for our country and how the nation can benefit.
With all respect, while even we keep the India-centric discussion, we do have to understand what other countries are doing.
Oh, yes.
So that we can understand what, because see, medical tourism is, even if we be India-centric, our competition, it's not within India only. Sure. We are talking about Thailand, we are talking about Turkey, we are talking about Gulf countries, jumping into and capturing a very big pie. And the kind of marketing effort Turkey is doing, like airlines offering 25% discounts, hotels offering discount and all, those needs to be discussed as well. So, sorry to cut you off.
My intent was, can we have a structured approach? You know, we all know whatever you're talking. Well, I work in, let's say, Maldives. They send all their patients, 120% is paid. 120%, 100% for the treatment and 24% for the family. Everything is paid. I know of another country, in Zanzibar, which is a part of Tanzania, 100, but they all come to 2-3 hospitals in Chennai or Kerala, you know. So that is how it works. We don't work in a manner that the whole, the country or the nation could have benefited in a particular approach. Therefore, I made some pointers. Will there be a need for a regulatory guideline or forget about regulations, some guidelines or a council? Any thoughts on that? Or else I will have to speak on that. Because we have Dr. Panigrahi and Sanjeev missing. So they would have given the business outline, how much business do they get out of this. So I will compensate on their behalf. Yeah, Ishan.
Thanks, Dr. Das. I think we discussed this offline also, but yeah, giving a perspective to the audience who are sitting here, I think taking a clue from what Dr. Prem Jagyasi just pointed out, it has to be a cohesive effort. At the end of the day, India as a country is doing great in silos when it comes to promotion of medical value travel as a destination. But what we require is a collaborated effort, not only from the industry players, but also from the regulators. Until and unless we as a nation, as a country would not come together, sinking in the ministries, the states, the policies, we would not be able to achieve what Turkey or Thailand has achieved. We have to map down the entire journey of a patient who's thinking of coming to a destination like India for treatment. Right from the connectivity, right from the hotel infrastructure, right from the city infrastructure, right from the transparency in terms of prices, right from giving opportunity or giving post-care those facilities to the patients. I think entire government, be it federal, be it state government, they have to develop a policy which is conducive for this sector. At times, what industry faces is that we feel that it's a kind of an open child where nobody is taking a responsibility of it. Fortunately, in the recent times, we have seen a lot of intent by current government from the Ministry of Health and Family Welfare. They're taking it seriously. They are thinking about the sector. They are looking at having some sort of institutional engagement with the countries, because that is when we only be able to have a lot of transparency and also a lot of bulk patients coming to India and getting themselves treated. You rightly pointed out that India is not only about the therapeutic treatment, but it is also about giving a holistic experience. I came from a background where I had the AYUSH committee in FICCI. You would be surprised that NABH now also accredits AYUSH hospitals, and that is getting predominantly, famous in developed world. You see a lot of UK, USA, and all developed world patients coming to India. And it is not only therapeutic, they're coming here for a preventive thing also. And with the digital intervention, which recently government has also been advocating, for which portal is being created, I'm sure Akriti, my good friend, would give you more light on that portal. These are the interventions which are required, and they have to be sustainable. One thing is to launch something, but another thing is to make sure that we sustain it. We make sure that we are improvising as the days are coming. The previous session where we were talking about AI and machine learning is also something we have to incorporate in the sector that would give a lot of boost to the MVT service sector as a whole. Thank you.
Okay, before I come to Akriti, I have some pointers, from this discussion. Because Ishan represents the industry bodies, so they can do a yeoman's. I'm sure they are doing already, but they can take it further. I think Dr. Gyani would be coming because when he started or got this idea of NABH, he got together a few of us, 5 of us, and we wrote the standard. So that is the part of Quality Council of India. So I have no idea whether FICCI has the intent of, tying with some degree of council so that they're not regulatory bodies. They are not regulatory bodies.
Just to mention here, FICCI was instrumental with NABH in creating a standardization
I'm a part of that.
medical bilateral facilitators.
Yeah, that is 2005. Yes, so yes. Yeah. Now we work with the Exim Bank. So the Exim Bank, MEA has published guidelines how Indian consultants, Indian builders or construction companies can only do this job, and 75% of the items could be Indian content and 25 can be foreign. So, some degree of these kind of guidelines we publish and adhere to. That only probably these bodies can, push forward rather than leaving it to the state governments. Or I don't think that will work. I don't think that will work. I have some degree of this, we all know this hub and spoke model. Hospitals in silos, as was mentioned by you, they have some referral points in those countries wherein they have a satellite center or a clinic or whatever, and they have a connectivity and they solicit patients from that. That is how mostly it operates, So is it a great idea to have a overarching body which gives you the guideline even for the satellite centers or the, The second was this patient is fine, and the family indulges in a lot of logistic issues. So you have the hospitals and they provide for an accommodation somewhere there. Patient is discharged after 10 days or 7 days of hospital stay. So I was thinking we had deliberated this skilled nursing facility or a assisted living facility or maybe a rehab facility. These 3 models do not work in India because they are not paid by the insurance companies. Whereas in the developed nations, they are all paid by the insurance company. Here, even if the patient is out of pocket paying, if the facilities can be created, all that the patient after post-surgery needs a little bit of nursing care, little bit of diagnostic, little bit of dietary, A patient does not have to go back and forth to the hospital. That creates a lot of inconvenience, So some nurses, some pharmacists, some physiotherapists, and basic diagnostics like lab tests and X-ray, that would amount to a skilled nursing facility or an assisted living facility. That model should emerge out of your write-up or discussions that you indulge in. Yeah, well, now I think before we move to ethical issues and quality, I will request, I think, Akriti to, deliberate on her portal that they have launched. She works for the Invest India, so I think let us hear out from her.
Yeah. Uh, okay. So thank you so much for inviting me, and I think my esteemed panelists have already touched on some of the parameters that I can probably elaborate on from Invest India side. And just before everything else, so Invest India is a national investment promotion and facilitation agency. It actually comes under the Government of India. So we work as a project monitoring unit for different initiatives that the government has. And in fact, one of them is the medical value travel, promoting medical value travel, ensuring that there is transparency that comes. And of course, Dr. Prem talked about how India is doing and how Turkey is doing. And in fact, I think just to add flavor to that, so India is currently at the 10th position right now, according to Medical Tourism Index. And on that, there are other countries that Dr. Prem talked about, Thailand, doing very well there. So we want to ensure that India can actually become, maybe in some years down the line, maybe 5 years down the line, be in the top 5 industries. So what was more important that probably is discussed in this panel as well is to have a holistic approach to ensure that there is a structure to it. So for that, we are actually working, Invest India is working with the Ministry of Health and Family Welfare on, we do have a MVT council that was created, yes, so that was created last year. So that was part of the strategy that we built for the ministry along with the health officials as well. And along with that, we have the portal that ensures all these logistical issues, all these transparency issues that come, especially for the attendees as well, because they are the important part. They shouldn't be falling sick during the process, right? So, and it's a very tiresome project when one's loved one is sick. So it's very important that they are also taken care of. So this portal, actually, it was in fact launched during the G24 Health Working Group. And the portal is operational right now. It is called the Advantage Healthcare Patient Mobility Portal, which ensures that there's transparency. If there are any logistical issues, we have also built in grievance module, which is very important, considering everybody should have onus of the different issues that people are facing. And there is a specific turnaround time as well for resolving those issues. So I believe such forums that we create here today will help us improvise the portal as well. And in fact, ensure that a lot of people, like for example, Ishan spoke about including AI and maybe building some models as well wherein we can improve the portal. And of course, industry can come and give suggestions also for the portal. We definitely work with FICCI a lot on understanding the different kind of challenges that the industry face and how we can improve the portal. So I think such panels can actually help us understand what we can improve and how we can improve the different kind of ideas, and especially basis your international experience as well. We can include those best practices in the portal and as well as in the strategy to ensure the ranking gets better.
Thank you, Akriti. I think we have discussed pretty much whatever we started on. There are 2-3 points which still are left. One is definitely ethics and ethical issues. Second is quality. Quality, I think I had written a standard for the UAE for medical tourism, and I don't know whether we have something in the anvil that we want to have a standard accreditation or otherwise for this medical value travel. And would you like to talk on the ethical issues concerning this, Prem?
Sure, I think so. In medical tourism alone, ethical issues not only alone you need to understand. You need to also understand the cultural issues, the different barriers which you will have. For example, you're talking about the language barriers you will have, because you are getting patients from all different regions. So if Bangladeshi patient comes, is entirely different than the patient comes from Africa, or for the wellness, which we rightly agreed that for therapeutic patients are coming from Western country a lot. So we do need to understand all these things, and ethical issues are very different than legal issues, by the way, and ethical, legal, and cultural. So what we need most important is called capacity building, as you rightly mentioned, that you have created standards for UAE, and I have also worked with many government bodies, just like Akriti, the way she is working, and I have worked with many government bodies. And also it reminded me, Dasji, your another question which you said that do we require that national, I think so there was a question which you asked that what is the model of the national committee, right? So it goes all together, by the way, when we talk about ethical issues and legal issues, because unless we understand the key challenges in medical tourism and what exactly are patients looking for, most of the time you will hear in a healthcare platform, most of the big doctors and hospital CEO, they says, we are the probably #1 destination because we have good doctors and great healthcare facilities. And undoubtedly, India has incredible healthcare facilities, great doctors, but sorry, my friend, that is not only requisite, that's not only requirement in medical tourism. To success in medical tourism, to taste, forget about digest, just to taste a success in medical tourism, you need to have a comprehensive support system. Because patient is coming from altogether different culture, he's not speaking your language, he doesn't like your food, he doesn't have the kind of money you are using, right? So lots of African patients can't even bring the dollar to here. So they have challenges which are beyond your healthcare understanding, right? So here we have to understand what is ethics. So organ donations comes, patient conversion, money comes in, how to deal with that, that kind of capacity building is important, I guess.
Thanks, Prem. Okay, before we conclude, we are on the 20 minutes bar. One last question and we close out. That is Indian rupees internalization. What he said about dollar pricing. We all get very happy when you get payments in dollars. But then, you know, how the government of India is trying to... can you give a thought, you or Akriti, either way?
So,
Thank you very much.
you know, this is, I'm glad that you pointed out this question across to me. In the recent interaction that we had with Ministry of Commerce, I was discussing with our Akriti also offline. One of the important, you know, recommendations which was given by the industry, that can we increase the, you know, the ballpark of 5,000 USD, which normally patient can take to another level. The recommendation was sent to RBI, and we also got the response, FICCI got the response that there is no limitation as such. They can come with more than 5,000 USD. It is just that they have to declare it. And also 10,000 by, you know, traveler's check also they can, you know, put in. One kind of a, you know, it can be a foresighted recommendation, and you know, I'm sure machinery and you know, professionals can look into it. How we can perhaps internationalize our UPI system. If UPI would come, and globalization of UPI would actually be a game changer. We have seen it in India, the way it has actually eased the entire thing in our day-to-day lives. The kind of impact that it can give it once we start with low-hanging fruit, start with Southeast Asian countries where you can introduce it, and then perhaps go beyond. I think it will help the medical value travel industry also in a big way.
All right. So I think we have touched most of the points. Akriti, I have tempted to ask you this, whether in the portal, do you have a database and by which you have specialization-wise doctors classifications or area of expertise-wise hospital classification, payment-wise classification, so that when you talked of AI, you know, or machine-enabled tools, is it possible, or that is in the forecasted activity future?
So actually all the points that you have mentioned, we have actually included in our portal.
Wow.
And in fact, we have also included the price range because sometimes patients
bracket.
come from different economies and they would like to maybe take up a surgery at a hospital which is like lower price. So we have all those filters. We also have the gender filter because sometimes, so we have included everything that we thought from the different, like we were speaking offline as well, from the Dubai health authorities. Abu Dhabi also has a digital portal.
Yes.
We also looked at different portals. So we have included everything that we could. And of course, with these discussions, would love to hear your feedback as well as to what else we should include.
Well, that is quite impressive
Yes.
to start up. There is a start point anyways.
Absolutely.
So you have taken the lead. Thank you very much for both of you. Prem want to have a point here. No?
Just because you started about artificial intelligence, I mean, many a time this terms goes beyond our, thought process also. What is artificial intelligence? To simplify, the computers and science, creating something which is equal to human level. And AI is working extremely beautiful at this moment, not only in structurizing the medical tourism, but also patient lead generation. We are providing massive number of patient leads to many hospitals across the globe, one of the leaders, and we use AI technology. Reason why we use AI is that because it is very hard to find particular cancer patient, if you're orthopedic hospital, particular orthopedic cases and spine cases, and the patient who have willingness to travel, they have a passport in their hand, they have money also to travel, because it's not easy to find all these things. And in healthcare, you would surprised to know 60% of your healthcare marketing is wasted. So where you invest all your money is wasted, but AI is changing that scenario. So just one point
Thanks,
I want to mention that.
Okay, I think I should conclude. Thank you very much, the audience. Yeah, I'll take a question. Yeah, our friend is asking a question. Yes. Yeah.
It is, they showed that 0.5 beds per 1,000 patients, one doctor for 1,500 patients. And as per standard should be one doctor for 150 patients. When you don't have enough doctors for your Indian population, how your medical health tourism will be beneficial? When you are not at all getting into that mark, and you don't have enough manpower, enough doctors, enough paramedical staff for your existing patients. So how you are thinking to go for this?
I'll try to answer that. We have enough manpower. I mean, we are not talking of numbers, but we are, both quantity and quality. So there are enough good practices that are being inculcated and practiced all over our country. Well, both in the private and government sector. So I don't think that is a matter of concern. There are good manpower. It's just that they are not available all over the place. I mean, a very skewed distribution of the manpower. They are mostly concentrated onto the cities like, Mumbai or Delhi, or you come from Bhubaneswar. Bhubaneswar will have a clustering of good practicing clinicians, and Cuttack also. But you won't get that in Kalahandi, and, so that is how it is.
So
thank you very much for your patience and hearing.
I will also just add to his question, because a really brilliant question, by the way. And it is not raised only in India, but if you talk about Thailand, if you talk about Malaysia, talk about Mexico, Costa Rica, the leading medical tourism destinations are not the one who are providing exceptional quality healthcare services already to their own country. But healthcare challenges are there. Even if you go to US, they might have manpower or money, but you can't get the appointment or treatment. So healthcare challenges are there. What Mr. Das and our team are trying to say here is that the kind of surgery patient require, we kind of have enough resources to do those surgeries. You don't need to wait here in India 6 months to 9 months for just a knee replacement. Even for the dental, I was in just right now in Switzerland and Turkey and all. And patient from Switzerland comes for dental because you have to wait 3 months and 4 months. So with respect to question is brilliant. How you do it is the way Malaysia model is done. How much percentage of international patient should be allowed, and where you reinvest that money. Because the foreign revenue is a great thing for our economy, isn't it? How you reinvest. Maybe we use that money and develop our rural area. So instead of omitting it or cancelling it, maybe reinvest, leverage. See, my colleagues are helping me with the words because the question is brilliant.
But how much is it? 20% or 25%?
I would say 15%. Do not go
20%,
above 15%.
not even 20%?
No, not at all. I would not suggest that. I would strongly recommend to just keep 15% bar for international patient and try to set it
15% will not be able to cross-subsidize the whole, you know.
I agree, but you see, with the 15%, you are giving more opportunity to all other healthcare providers to participate.
Okay. Thank you, Prem. Thank you, Akriti, and of course, Ishan. It was a pleasure hosting all of you.
I just have one question.
Oh, wow.
To Ishan. Hi. So my name is Nimel. I'm coming from Pune. I run a digital transformation agency. We are premier Google partners. So what Akriti is doing with the platform today, we did the same called Study in India in 2016 when Smriti Irani was in office. And we generated 15,000 leads from Africa to, for students to come to India. So that's my primary background. We are working with healthcare. I have got clients in US. We are working with them in elderly care and nursing and all. We work in UAE and we also work in India with hospitals, clinics. My question is that when we attempted, and we have also got success when in some cases for bariatric, IVF, on some other treatments, we have got patients from UAE, we have got patients from Africa. But a lot of my clients who have, were not big in their size, like, for example, Medanta is or other hospitals are, my clients do not have that kind of an appetite to invest and test the markets. So what is FICCI or government doing to, educate more specialized hospitals, which may be very small in the size? So one Pune hospital that I work with, bariatric, fantastic results, only 25-bedded hospital. His appetite to invest is very limited. So, and I am connected to many more like that. And what Mr. Prem said about dental. I studied in Australia, I got dental issues. Instead of taking that treatment there, I flew back to India and went back. It was cheaper. So I understand it firsthand. So what FICCI or government is doing to maybe help these smaller clinics or maybe, intermediaries like us, if we get involved, because I am generating leads, I am getting business. But my problem is that firstly, I have to convince the client who is the doctor or a clinic. Then I have to run the campaigns. I have to then qualify them. And then also the norms of, donor and other things. And then bring it down. So, people like us who are SMEs, MSMEs, we can really bring the difference. We can participate and there would be many like us. But what government is doing for us or maybe, what kind of platform you can give to us or maybe train these clinics and doctors or maybe give them some kind of, bounties or financial help. So I just wanted to know about that.
See, investment part is something which I would leave it to Akriti because they are the unified investment agency recognized by Government of India. But I would just give you one piece of information. See, government acts as a facilitator. They are not a educational institution or a kind of a institution which can show you how to do business. They would only give you suitable environment wherein you can have investment coming in, right? Now you also as an investor need to think beyond tier 1 cities. We have been experiencing a lot of rush coming to tier 1 cities just because they have the big brands and you obviously being a mediator get lured to these kind of metro cities. But in the recent times we have seen tier 2, tier 3 hospitals and healthcare centers showing exceptional capabilities and they are doing exceptionally good. I was amazed to see many of those Ahmedabad hospitals doing so great and being specialty. Shelby being one of them, now being such a big brand is an exceptional example. I think forums like Advantage Healthcare India that we do is one of the pioneer amalgamation of thoughts and It's a big MVT exhibition, now perhaps the biggest in Asia. We have the amalgamation and interaction of all those investors coming to India, and they have an interaction with all those hospitals. So we create a level playing field where only those Apollos and Medantas are not getting benefited, but other smaller but very capable institutions are getting publicized, and thus create an opportunity for you to interact with them for the potential collaboration and business. I'm sure Akriti would just add to it, because at the end of the day, it is an investment which is coming inwards.
Yeah, I think we are running out of time, but would love to speak to you. Like Ishan said, there are different platforms and there are different kind of incentives also the government gives for setting up, going for these marketing development assistant, the MDAs that people get for traveling to other countries to ensure that people know about their hospitals as well. Would love to chat with you offline. I think we are running very short on time. So thank you so much. Yes.
Big round of applause for our speakers. I would request Manish ji and Afzal ji to please come on stage to present our speakers with mementos for coming here and sharing their expertise with everyone. I request you to please present a memento to Dr. Bidhan Das, Managing Director, OCTAVO Consulting.
You didn't. We saved the 10 minutes. You were supposed to have 14 minutes.
A memento for Dr. Prem Jagyasi. A memento for Ms. Akriti Bajaj. And a gift for Mr. Ishan Pandita.
Oh, they would have to have a photograph as well.
I request all of you to please gather for a group photograph.
This come after you.
Big thank you to our speakers.